Yeah, good day and welcome everyone. It is wonderful to have you with us. I'm Sai Pradikta and I'll be your host and moderator for the next 45 minutes. Joining me are two remarkable people who, between them, have spent decades inside hospitals, health networks, and transformation projects spanning the Middle East, Africa, and the Caribbean. Today isn't just about a conversation, it's more of an experience. We have some genuinely exciting AI features throughout the session. And trust me, you'll want to stay for every minute of it. So, we're talking about tools, we're talking about ideas that could change how you think about healthcare delivery. Your audio has been muted, so please sit back. We have the chats enabled, and I'll make sure the best questions from the room gets the airtime they deserve. It's my pleasure to introduce our speakers for today. First, we have Matthew Abraham, Vice President and Head at Medina's. He has over 25 years in healthcare IT as a business head and operational leader across the Middle East, Caribbean, and Africa. Next, we have Narendran M., Chief Transformation Officer for Healthcare Transformation and Strategy at Medina's. He is a system strategist who helps leadership teams not just implement technology, but fundamentally rethink how their organizations operate. With hands on experience running his own chain of hospitals, he brings a rare dual perspective as both a healthcare operator and a transformation expert. Matthew Narain, welcome. The floor is yours.
Thank you, Sai. So before we get into what we can fix in the hospitals, I probably want to give all of you a sense of who we are and where we operate. So Medinaus is a software product company primarily focusing on providing solutions to hospitals and clinics. We've been around for about 25 odd years, and today we have customers across the globe in Africa and the GCC as well as the Caribbean islands. You know, every day our software runs probably 100,000 plus transactions on a daily basis. And the footprint that you see, the kind of clientele that we've been able to add is remarkable in these areas that we operate. We'll move on, Sai. So the question that I want to probably put out to everybody and what's probably in everybody's mind is, why do hospitals running a hospital feel much harder than it actually really should? You've got talented people, you've got the best doctors, you've got patients who seek you out, yet somehow the operations never seem to run the way you want them to. And that's something we found out in our experience of having worked over the last so many years in this space. And it basically comes down to three things. The primary thing is visibility. You can't manage what you can't see. And you need to be able to see the entire aspects of the hospital. The other one is revenue. Hospitals today leave millions on the table, not because they're not working hard, because the processes are broken as such. And then, of course, is the issue of compliance. World across, the regulatory pressures are increasing, they're tightening, in our markets, and hospitals that are not able to be ready for that are going to find it really difficult. So tonight we're going to look at all these three, not in abstract, but we're going to look at it as like not an abstract as in a 5-year plan that we want to do, but in a 90-day plan. Here's what you do today, what you do the next day, and going forth. Now, I also want to be very honest about what some of the challenges that hospitals are facing, because I speak very frequently to CEOs and CFOs across the spectrum in different regions. And the story is more or less remarkably the same that you would find. You're managing multiple problems at the same time. You feel that the operations are more reactive. You know that the revenue should be higher, but you can't quite exactly find out why that's not so. Like I mentioned, the compliance issues are creeping up. They're multiplying faster. Your teams are not able to tackle them. And the operational challenge, as it is more a visibility problem. Systems not talking to each other seamlessly. The billing section doesn't know what the ward is doing. The ward does not know what the lab is doing. They all work in silos, and nobody really has the entire whole picture. And then, of course, the revenue challenge. That's almost a process problem. Between the time you raise the invoice and then finally you get the receivables from the payer, your money gets lost. You have 12 to 15% that's often denied for one reason or the other. And that's basically means for every dollar that you raise an invoice for, you're being short by 10 to 15 cents. And of course, the compliance challenge. It's if it's in Saudi, it could be the Nafis, it could be Zatka. In Africa, you've got the MRE. Different challenges, and you cannot defer compliance. It comes with a date, and that's what you have to do. And probably the good news is what my colleague Naren is going to be talking and walking you through in how to overcome this. And Naren, it's over to you now.
Yeah, thanks, Matthew. Hey, hi guys. Wonderful to see all of you here, and I think super happy to spend today's evening with you folks. Specifically addressing certain challenges which we all face together. I have a rare this thing of being on both sides. I run a group of hospitals to take care of eye care, as well as I'm part of teams which are building to change the perspectives in tech for healthcare. Okay, I think just rephrasing what Matthew just spoke about. I think we have three layers in some ways. One of the layer is to manage our work, right, which includes getting a real single view of our operations. Have a coordinated care across departments. I think that's what we are trying to do, and I call that as part of managing our work. That's what it is. That's the base layer for us. And you need systems for that. I think we have some systems today. In fact, Medina has a system. There are many more systems like that. These are the typical HMS systems or ERP systems, what we are used to using. Okay. They allow us to operate today. They allow us to help automate our operation or workflows, all of them. Okay. But definitely, that is one part of the business. But the next part definitely is how do we grow? Okay, I think that is the second layer, what we're talking about. And to grow, I think today there are newer things, newer trendy things which we can do. We will specifically talk about few things on the growth side. One is in some ways to automate physician workflows. Okay, that is one way to grow, because if you can help your doctors or physicians be more efficient, see more patients, that is definitely growth, right? So we will talk about how AI documentations or a AI co-pilot kind of a thing or a decision support will help doctors improve their quality of work, improve their efficiency. That is one thing we'll focus on. The other piece we'll focus on in the grow is to improve patient experience, right? Patient experience, patient engagement. I think that is one thing which I think there have been multiple attempts to fix that, but I think it is still a work in progress thing, right? Uh, Specifically today, the world is completely moving towards being consumer centric, right? But healthcare, we all know that. Okay, still we need a long way to go there. Okay, so we'll talk about how we improve uh, patient engagement, patient experience through certain AI products. Okay, we'll talk about that. That is important. And also, when we say that we will build these systems, we'll build this data, we'll build this automation, what we are actually doing is we are working on lots of data, right? Now, when you collect data, okay, the important thing would be to also to maintain it and ensure that you have the data safe. Okay, your patient's data is safe. When it comes to security or privacy or confidentiality, you ensure that the data is safe. It adheres to certain compliances. It adheres to certain standards so that you will have safe and secure data to operate on. I think that is the protect layer we are talking about. Okay, so we will talk about all these three layers together, and also certain new age tools what we are building on top of the base system is what we will talk on. Okay, yeah, so let's move ahead. So as I said, the base system which helps us to manage the workflow and create that data for doctors today is very system centric. So it is about automating those workflows. It is about ensuring we gather the data. It is all about integrating clinical workflows. That's what we have built. It is all about integrating a revenue cycle. That is something what we have built. Of course, and at the same time, we had to operate with certain regulatory compliance. I think that is one more thing we have built for the physicians, okay, in the existing system. Okay. What we have done for patients in the existing system, of course, we have been building something. There are certain things like for example, we allow patients to book online appointments. We allow them to share documents with the hospitals. Okay. Some of them, and we also built some kind of a limited patient communications, but they are very limited. When I say they're very transactional, they are specific to some information alone, but not taking it to the next level of engagement, a bi-directional engagement, where it's just not the hospital trying to share something, but it's also allowing the patient to share something. Okay, that kind of bi-directional workflows are not there in engagement. We will talk about that. We have some exciting tools. We will show you demos of them in action, how it is changing certain things. Okay, so that's what we're talking about for patients, and of course the providers, right? What we have done, right? We have bought them a lot of operational control for the providers. We have bought a lot of financial visibility. We have helped them procure better, sell better, okay, with good margins. And of course, while doing all this, also be compliant to regulatory requirements so that they don't have a risk of non-compliance. I think those are the things what we have built. These are part of the base system. This is part of the manage part of the workflow. I think we will now move into what we are doing specifically for the grow part of it, right? Because we all want to also get into the grow part of it. Okay. This is where we're talking about on the growth side. Again, we are saying that we can bring growth by building good experience for either a physician or a patient. I think these are the two things what we are saying. If we focus on this, if we make their experiences better, that will lead to growth. That is the crux what we're trying to discuss here. So I will talk one at a time. Okay, maybe from a patient experience, how do we improve patient experience, or how do we improve physician experience? We'll talk one at a time. So on the physician side, I think we're trying to build a lot of AI, or bring a lot of AI, which can work on the data what we have talked about till now. We have got data today, and that data, even though it's available for a doctor to review that data, okay, it is still little bit difficult. Okay, it is time consuming. Okay, let's think about a classic use case when a patient is there in front of the doctor. He has to review at least 10 things to look at and arrive at certain questions what he has to seek those answers. I will show them in the demo how we talking about. But today we are trying to say that on that data, can we bring one more layer? Okay. The inspiration again is from the world, whereby we're talking about GPTs today. We're talking about co-pilots today, which are very good in kind of data mining or bringing quick insights. Okay, we will talk about that. That is something what we're building for. Uh, in fact, if you see a doctor consultation, right, is a conversation. Okay. Today there are fantastic tools, okay, which can work along the side doctor on the conversation. Okay, convert that into clinical notes. Okay, and all of them automatically when the doctor continues to manage the patient more. Okay, that is one thing. When he's trying to do these two things, it is about decisions. When the doctor is in front of the patient, he makes a lot of decisions there, right? What is right, what is not right. What happens is, even though we all know that doctors are making them, but because of a lot of limitations and all of them, there can be, those decisions can be sometimes suboptimal. Okay, so it is good to have some kind of a guardrail system. Okay, that's what we call the decision support systems. Okay, which comes as a supplementary system, okay, to the doctor's decision making, and helps them to uh, make the right decision all the time. So we are also talking about certain clinical decision systems. That's on the physician side. I think these three things, when we bring to action, will definitely improve a doctor's experience, efficiencies, and his ability to see more patients in lesser time. I think that is what we're talking about on the physician side. On the patient side, I think we spoke about it. It is about fixing the customer experience. It is about building engagement, and also moving to more a patient-centric system. Okay. Plus, the world today is more moving towards self-service. Okay, if you see the way we do e-commerce or the way we do buy today, okay, it's all mostly on self-service mode, right? Rather than somebody selling to us, we go online, we look at things, we have all the information for us to make that sale happen, and we buy online. So it is in some ways self-service. Okay, so how much of the work today, which is more a managed care? Okay, so we tell patients, you come to us, we will manage everything for you, right from registration to you seeing the doctor to you going out of the hospital, we will manage for it. It's more managed care. Certain portions of this can be moved to self-service mode. We'll talk about that in the next slides. Okay, how we can do that. Plus a continuity of care. So if you see this whole episode of a patient having a problem and he trying to come to an hospital, has at least three stages. There's a pre-stage before he comes to the hospital. Maybe at that point is when he books an appointment with us, and then he comes on that day, and then we meet him, we manage him, and then we send him home. Okay, that is the post stage. Okay, so we are very good when it comes to the intra stage, or when the patient is in the hospital, because we have been doing this for many years. We have good people, we have good infrastructure, we have good doctors, nurses, people, all of them to take care of the patients well when they are in the hospital. But what does not happen well is when they are planning to come to the hospital or when they are left the hospital. We'll talk about these two things. So on the pre side, what I'm talking about is how do we move to a self-service model? Say, for example, after booking an appointment, we will have continuous engagement with them, okay, ensuring that they come on that day, because we all know today there are a lot of publications which says the missed appointment itself is 20% of patient losses what hospitals have. Okay, so we will try to fix that problem. Second is when they really come to the hospital, right? The biggest queues what we see in hospitals is the front desk, right? Where patient come in, and then we have to do those registrations, collect those forms, collect their identities, and then maybe bill them, give them the receipt, and then put them in the queue with the doctor. I think that is where the queue is. One way to do that is, can we move all this in self-service model? Okay, even before he comes to the hospital, can we ask him to do a pre-registration online? Okay, this can be done very easily today. Can we ask him to prepay for that appointment? Okay, to avoid queues in the hospital, right? Can we get their insurance documents submitted online even before they come to hospital, so that the hospitals can process it, keep it ready when they come? So these are the kind of things which can be moved to a self-service mode and improve engagement even before they come to the hospital. I said that when they're in the hospital, we are pretty mature there. We know how to manage the patients. Now the question really happens, what happens when they leave the hospital? Okay, classically in a OP setting, okay, the doctor, the patient comes in, meets a doctor, gets a prescription, and then leaves. Okay, and then just leaves. Okay, that is where it breaks. Okay, that is where we are trying to build certain certain products which will bring engagement in those areas. We'll talk about that in the next slides. But what we're trying to do in the growth stage is, okay, help doctors see more patients, improve their productivity, okay, which will lead to more revenue. I think that is what is growth. Okay, and of course, improve better experience for patients. Let's move.
Nareen, we have a question.
Yeah.
Yeah, what does omni-channel mean in the context of Medina's?
Yeah, that's a good question. That's a great question. Okay, it's very important to understand omni-channel. Today, customers have multiple channels. It's like, for example, we have a laptop, we have a mobile, we have many more things which we communicate with. We have multiple devices. In similar way, there can be an app through which the patient is trying to connect to the hospital. He can call into the hospital, okay, to book an appointment. He can go to our website and look and book an appointment. Okay, so like that, there are multiple channels through which a patient engages us. Okay, we should be able to provide a seamless experience and seamless engagement in all channels and manage these patients well, so that they convert into appointments for the day, plus we retain them also. I think that is how omni-channel really works.
Yeah, thank you, Nareen.
Okay, so I think we have seen the manage portion, which is about building those systems. I think we have seen the grow portion, which is about building systems which will help us grow. Then comes when we are building these two things. Okay, It's very important how we protect our data. I think that is very important. And on that side, again, we will talk about two sides to this. Okay, one is how do we help certain physician and providers secure their data. This is in the way of adhering to a lot of health authority or insurance compliances like NAFIs in Saudi, okay, or certain clinical standards, okay, which help hospitals get accreditations. Okay, accreditations are like the JCI or the CAP accreditations. Why you need accreditations? Because it builds credibility. Okay, and when you have to build these accreditations, you need good systems, okay, which can one provide those data which is required for those compliance, as well as ensure that the data is 100% safe and secure and adheres to those compliance requirements. That's what we are calling about protect. Of course, on the other side, it it need to be secure, it need to be interoperable, it need to be well maintained, right? That's one more thing. On the protect side, I think there is also a shift in the model of uh, data, okay, and the way we manage data. Classically, if you look at the financial institutions, right, we know that we used to go to bank all the time to make transactions, whether to deposit money or to withdraw money, because the bank had core banking systems. Now, what is core banking system? These are closed systems. These are closed private systems, and you cannot access them from outside. Okay. Now, why did they do that? Primarily because of data security reasons. Okay, they just wanted their network to be safe, the data to be safe, and that's the reason they built closed private systems. But the day to day, okay, what we are asking for is open systems, public systems, right, which can be accessed openly, which are interoperable, which can be integrated with other systems. People can access it openly. Say, for example, the UPIs. We all know about UPIs. They have changed the way we do banking, right? And UPI is not what to say. It is not a transaction, but it is more a public transaction, not a private transaction. It's a public transaction. Okay, that's how those systems have changed, and I think a similar change is expected even on the healthcare side, just to improve patient experience, just to make a lot of new possibilities happen. Okay, and for those reasons, again, when you have to make the systems public, make the systems open, make the systems interoperate with other systems, it's very important that we have a very solid layer for data protection, data security, and compliances. I think that is where it is super important. And these are the three pillars what we're talking today: how we manage, how we grow, and at the same time, how we create a safe environment for us to operate our business. I think these are the three pillars what we're talking about. Let's move on. Okay. Now that we have spoken about the crux of what it is, and we are going to get into very specific about when we said that we will help you grow your business, okay, by improving the doctor's efficiency. We are building something known as Cura.ai. The inspiration is more from the chat GPTs or the co-pilots, what we use today. And you all know that today, the way we use our emails or the way we write certain text or create certain documents was not the same way what we did in the past. It is very different today, much better, much easier. Okay, I will talk about what is this and how this helps it. Cura, for example, I spoke about an OPD consultation, which has multiple data. So maybe we will have a small peep into the product itself, so that you guys understand this a little better. Yeah. Thanks, Sai, for bringing this up. I think this is a classic OPD screen, or the screen which the doctor uses to consult a patient. Right on top, you have the patient details. And then comes this whole set of data, what we're talking about, from history to soap notes to lab, radiology, prescriptions, procedures, surgeries, documents, consumables. And it continues. It's at least 10 to 12 things there. Okay, that's what I said, that even if the doctor has to see, take 1 minute to see one tab, okay, we're talking about at least 10 to 12 minutes to finish his review of patient information, right? That is a lot of time. Okay. Now, if we have to improve this, what can we do? Okay. So if you see on the right hand side, okay, this is what we call as a co-pilot or something. It's an assistant tool. So this you can ask certain questions, right? As I said already, when a doctor is having a consultation with the patient, typically he has a lot of questions in his mind and he's seeking for those answers. And today the only way to find those answers is to go figure it out in the EMR. Okay, but we are saying that can we build something which will make it faster? So on the right hand side, for example, I can say, just tell me the patient summary. Right there it is, right? Very simple. Okay, it says the patient has these allergies, is on these medications, and his vitals is this. These are his lab results. Very simple. Okay. Similarly, he can even ask the thing about, tell me the last 3 episodes of lab results. Okay. And there it is. So what you do, okay, on this particular day, on this OP visit, he did a HbA1c. On this OP day, he did a ECG, which was normal. On this day, again, he did a HbA1c. So like that, very quickly, you can find some data, what he's looking for. You can also ask, for example, tell me his BP trend. For example, it's very important if the patient is having high BP. You can quickly see what is his BP trend. Okay, and this can be easily converted into a trend chart instead of showing data, but data is directly available to you. Okay, say for example, you can say, tell me his active allergies. Okay, so you just click there and then there it is. You see that now what are the allergies the patient is having. So like this, he can quickly operate on these prompts. Okay, and these prompts are not restricted or they're not pre-done. There are some pre-done ones, but the doctor can write his own prompts. Okay, say for example, he can come down and ask something because he can query the same EMR data in natural language. He can tell me the sugar or blood sugar trend for this patient for last 3 years, and he should be able to get that data. And once he is able to do these prompts, he will typically operate between 15 to 20 prompts. He can create those prompts and save those prompts, and then he doesn't even have to type. He can just click on those prompts and get the data quickly. Okay, this is something we are building. Yes,
Yeah, Naren, we have another question.
sure.
Does the AI feature come embedded with the system or is it an add-on?
Yeah, this will be embedded in the Medina system, but this can also be provided as a plug and play system. Yes.
Yeah. Okay. Thank you.
Okay. So that is how we are trying to improve the time taken by doctor to review the information of the patient and arrive at certain answers what he's seeking for, so that he can continue. So in this case, if we see in just about 2 to 3 minutes, we are able to figure out whatever the questions are there in the doctor's mind, and he can continue to treat the patient. Okay. Yeah, let's move on. So this is where we talked about, okay, 37% lesser time on record retrieval and analysis. Okay, as well as 40% reduction in the documentation burden per session. Okay, this reduction in document burden because he is spending less time reviewing documents rather creating more documents. Okay, so that is how we are trying to build systems which will help doctors with their efficiencies, improve their efficiency, make them see more patients. Yeah, let's move to the next slide. Okay, so that was on the physician side. And as we said that we are building on the physician side, we're building on the patient side. We're also building for the providers, right? So this is on the patient side. And we spoke about customer experience or patient engagement as something which needs work, okay, which can be improved today. And we spoke about the last part when the patient leaves the hospital and continues to take the prescription given by doctor. How is he going through that engagement today is broken. In fact, that is not monitored, that is not kind of managed. It is the patient is left to himself. Okay, that is where we're going to talk about. So we call this as care loop. And the reason why we call this care loop is today we feel the care loop in some way is not closed well. Every episode which the patient has needs to be taken care and closed well with a positive health outcome for the patients. And that is where we are talking about care loop. It is a proactive post OP or a post discharge continuity care system. Okay. This comes in even before the patient gets into the system and continues even after the patient leaves the system to the time he gets done with that particular episode. and somebody says that that episode has been meaningfully closed for the patient. Okay. We can get into the system. I think that will be more easier for us to understand the system. We can straight away get into a small demo of the system. Uh, so this is a simple prototype, what we have built to showcase the system. As I said, it is a plug and play system. This can work with any HMS there or any other system. All that it needs to work is a simple prescription. Okay, it is the advice which the doctor gives a patient, right? And we all understand that typically a prescription has these components, right? Like what is the patient detail or the consultation, then it might have certain medications what the doctor has prescribed for the patient. It can have some lab investigations which has been advised for the patient. It can also have certain instructions which are given to the patient, which needs to be followed by the patient. And of course, at the lab, the doctor may say that, okay, you take this medications, get this test done, and maybe come and meet me after 3 days or 4 days, right? So that's a follow-up thing which comes up. So it all needs is just this prescription as API. And from that point, it will onboard the patient onto the system. And once it onboards, okay, what we say, there are two ways we look at patient. First is engage them, explain to them what is the prescription itself. So we'll go to the next part of the system, which is what we call as the priority queue. Now, why is this priority queue? Okay, so let me step back a little bit, right? We spoke about patient engagement, right? Now, patient engagement needs to come through a doctor because that everybody wants a doctor to advise them, a doctor to tell them something. Let's say in a classic sense, in a OPD, a doctor sees 30 patients. And if we say that, doctor, will you be able to engage these 30 patients because we want to build better systems, improve customer engagement, all that, the doctor is definitely going to say no, because continuously engaging 30 patients on a daily basis is going to be really tough for the doctors, right? But if you say that, normally what happens with 30 patients, there are these 25 patients who go through a normal recovery path and then they have positive health outcomes and they get better, right? They get the problem solved. There are actually 2-3 people who might have certain problems when they go through this episode. But the worst is there might be 1 or 2 patients who might have some adverse incidents. Okay, they may not be responding to the care path. Okay, and may need doctor's intervention. If there is a system which can create this prioritization, right? If it can say that, oh, this bunch of people are progressing well and they are on track to recovery, but this needs some kind of attention. But this definitely are critical patients needs doctors intervention. If we can prioritize the patients and then tell doctor that, will you be okay just about engaging these 2-3 patients out of the 30 patients? I'm sure doctor will love to do that because they really want to do this, but it is just that it is not possible today to do. Now, why is it not possible? There are no such systems to make this happen. Okay, that is what we are trying to fix. And when we say that prioritization, it is a risk scoring model. It uses certain algorithms in the back to figure out which patients are progressing well and which patient need attention and which patient are really critical. Okay, so that is the crux of the system, where there's a risk stratification engine which works on the back with the engagement with the patient. Okay, so that is important to understand. That is one part of the system. And the second part is the whole engagement platform. It connects the doctor to the patient, and it connects the patient to the doctor. It connects the care provider, that's the hospital, okay, or what we call the care orchestrator, to both patient and doctor. But definitely this system is a doctor monitored, doctor managed system for care. It is not independent, but it comes from various levels and at what point doctor should intervene. Okay, so let us go into how the system really works. If you see on the top, that's why we are given here. This is the whole set of patients the doctor has seen, and it has already classified them into certain critical patients, certain at-risk patients, and certain patients who are on track. So anytime you can see them. Let us pick up some patient. Let's pick up Nora in this case. Okay, so once you pick the patient, you can see the whole engagement, what's happening here. On the right hand side, if we say, it has already given that care gap risk and certain critical symptom has been reported. We will go through what happened to this patient. In this case, this patient came into the hospital with abdominal pain, and there was they were investigating her for appendicitis. That is there. And the second thing, if you see, is something like medication adherence. I think it is super important for all of us to continue treating the patients well. In the IP side, I think we have good systems which comes back and gives us very good scores on what is the medication adherence. Okay, but whereas in the out of hospital care, we really don't know, okay, whether the patient has taken the medications and has he completed the course. We really don't know. That is a super important information for the doctors to say that is the medicine working, or should he change it, or should he look at a different care path. So I think just with our engagement thing, we are able to bring in medication adherence to a very large extent. That is one thing. So let's go and see how does the engagement timeline is. So if you go down a little bit, it started with the care plan being sent to the patient. So what is the care plan is the prescription. So if you click on the first engagement, this is how it shared the prescription with the patient. It just sent to him, hi Nora, Dr. Williams have shared your care plan. And this is what it is. You are taking injection, you have to do abdomen USG, you have to review with him in OPD at some point of time. So this is a simple way to explain the prescription. There can be certain instructions which also can be said. And it asks them or prompts them that, no, do you understand this, or do you want me to summarize this or explain certain things? So that options are given. If they say that they understand, it continues further. Or if they say that, no, I want to understand this, this then gets to the next level of explanation of what is this injection, what is the USG, what is the instructions given by doctor in plain, simple language so that the patient understands that. Let's go to the next engagement. This was the next engagement, okay, where it said it was time for medications. It can track medications and when they should be taken. It will prompt them that you need to take this medicine at this point of time. The patient can say that, yes, I have taken it, or he can say that, please remind me after 15 minutes so that it reminds him again. This is where we bring in medication adherence. When they say that we have taken this medicine, we are able to track that medication adherence. And then there are other engagement messages. For example, on the USG abdomen, it tells you that, no, the patient that you need to go to this hospital tomorrow for a abdomen ultrasound. Okay, so the patient can confirm, yes, I'm going to go. So that reduces the risk score. For example, there are 2-3 such messages and the patient doesn't confirm. It is a risk because the patient may not come. So that increases the risk of the patient, and it notifies the care orchestrator that this patient is silent, he may or may not come. Okay. And sorry. Okay. And that is how we bring certain interventions to the care orchestrator also. Or even the patient, if he wants to reschedule it, that can be done very easily here, right? And let's go ahead. And that was the next engagement. Yeah. Other thing is, for example, there are certain reports which get ready in the hospital, right? Maybe they had given a lab test and that report got ready. That can be immediately shared through this channel, okay? So that the patients can see that. And the next level of report is, reports have a lot of medical terminologies, right? Sometimes the patient doesn't very clearly understand it. So he can easily ask the system, can you explain me what is in the report, right? So it explains to them in a very simple manner that this is what the report says. Okay. After that, I think for this patient specifically, the last one, if you see, there is some critical symptom reported by the patient. What is that? The patient had severe stomach pain and she also vomited, right? That was what was reported by the patient. The system has caught that as a critical event. It has flagged that and it has made the patient critical, intimated the care orchestrator that now you have to intervene. And the care orchestrator has caught this message and he has sent a message to the patient that your care team has been informed and will contact you immediately, and we are monitoring your situation. And so it sends a message to the patient, and at the same time, he also sends a message to the doctor that this patient has complained of severe stomach pain and vomiting. Okay, this is a classic case of appendicitis, right? So we have directed the patient to come to the emergency. So the doctor can also at this point intervene and say, okay, if something has to be done to the patient, or he can come to the hospital and meet the patient. I think that is classically how we take each patient and each episode of the patient and ensure that that grows to completion. Now, if you go up on this, okay, let's say, let's pick up a normal case. Just go up. Yeah. Yeah. So on the right hand side is what it tells you. How did it arrive at this care gap? How did it arrive at this risk? What it is identifying? To come little down, okay, it also says there are suggested actions. What actions can be taken on this patient? Say, for example, the care orchestrator can send a WhatsApp message to the patient anytime. Okay. He can call the patient in emergencies directly. Okay. He can log an outcome. Okay. What has happened? He can escalate it to the doctor that this patient needs your attention now. Okay. So otherwise he can also close the case. Now, when do we close the case is, for example, the patient has gone through the complete course and his health outcome has been positive. He has recovered completely. And maybe we also can use this as a feedback mechanism where we could also receive certain feedback from the patient. On all that, the care orchestra feels that this particular episode for the patient is done and he closes it positively. That's how we pick up an episode, take it to 100% completion. And if there is a escalation, it is managed better. Okay. If the doctor intervention is required, that is also brought in, but all of them with very, very limited human intervention. It's a very, very automated AI agentic workflow based system, which works on itself intelligently until the point that it feels that now there needs a human intervention. There needs a doctor intervention, there needs a care orchestrated intervention, and allows humans to focus on other things when they continue to work with the patients when they are not critical. Okay, I think that is the part of the system. On the left hand side, if you see, we spoke about specifically how this helps. It definitely is a system which is built to improve patient outcomes and bring accountability to those outcomes. Two is build a lot of trust between the hospital and the doctor with the patient, improve the patient engagement, build a channel where where there can be bi-directional conversations happening. Okay, that is one thing. Now, we also talked about this care gap, or there's a gap between the prescription or the advice what the doctor gives versus what the patient takes, right? Now, what is the meaning of that is that 30% gap is also services which the patient has not availed from the hospital. Okay. That can also lead to some potential revenue loss, right? Because these services, one, it needs to be done so that the health outcomes are better for patient. Two, when they are not done, of course, it leads to poor health outcomes. It also leads to revenue loss for the hospital. Okay. So with this engagement platforms, we think that we can reduce that 30%, 40% gap to maybe less than 5%, whereby bringing in that 20, 30% additional revenue, which otherwise would have just gone down the drain. Okay, so that is how I think it is a system built for engagement. It's a system built for outcome. It's a system built to recover certain revenues which would have otherwise gone down. Okay, so that's how Care Loop operates. We will go further down. It has many more things, but at least for us, for understanding, this is good. As I said, it helps in reducing no-shows. Okay, because it is a very AI driven engagement platform. And of course, we spoke about some revenues. It also helps in improving your revenue opportunity. So this was the second part on the patient side, how we are building to improve patient experience and thereby improving or helping your business to grow. Okay.
Yeah, Naren, we have another question.
Sure.
What happens if a patient ignores Care Loop's follow-up messages?
Yeah, so that definitely is an escalation. Okay, if the system is continuing to engage with them and when they don't see responses, there are certain ways to configure them. The care orchestrators is definitely notified, and so they try reaching out to them or they try calling them. Okay, so that the engagement starts happening.
Yeah, thank you.
Fantastic. So we have talked about the physician side, how we are improving them, and we have talked about how do we have certain AI systems which can build a lot of trust and improve customer engagement. We also have to talk about what new things we are building for the providers to grow their business. We are there talking about growth here. So what is growth? I think growth can come from data today because we have these structures with systems to collect data, and we all of them have good amount of data. Now then that data has to be put to our use, or in some ways people call that as data monetization as well. Okay. How can we monetize that is what we're going to talk about. Now, even to monetize that, you need to be able to visualize certain insights from your data, get those right live performance views, or no, all of them. That is one thing what you're trying to build. Plus, data today in healthcare is kind of it is all over the place. It is in multiple systems. These systems are database agnostic, data source agnostic, so they can connect with any source from your database to your Excel sheets and bring data together so that you see one source of truth in one place. Okay. Plus, we are also building certain CXO level real-time alerts which they want to monitor. Okay, those KPIs are sent as CXO dashboards in real time to the business leaders so that they can understand any delta and take any some interventions or take any actions. Okay, that's how we are building this intelligent MIS dashboard, what we call. Okay. Um, Now, when we set the data, and now how does this lead to growth? Right? That's one question, right? What is happening today? I think there is also a transformation whereby from being reactive care, we are moving more to proactive care, right? Reactive care is you have a problem, you go to hospital, they take care of you. Now, proactive care is people have your data, they understand you, and they engage with you, and they do some kind of a predictive analysis on your health and tell you from your current lifestyle, this is where you'll end up, or maybe you need some course corrections. Okay, that is preventive health or proactive health, and that is where we are talking about data. This data can be used to create those kind of campaigns, or you can engage those patients specifically who would need certain course corrections in life, and thereby also moving more to a preventive health rather than being on the reactive health side. I think that is how we are saying this data can help. And what we are trying to bring here is you can still continue to manage your work. You can understand all your operational efficiencies, operational these things. You can further use it for growing your business also in the way of moving from reactive care to proactive care. Okay, I think that is how these intelligent dashboards can help people. Yeah, let's move to the next one. I think we have come to the end of this presentation. As we started, we are saying that it is a 90-day game, right? To bring in transformation, to see how you manage your business today, how you grow your business today. I think it's not a long-term plan anymore. It doesn't need 5 years, for instance. It can be done in 90 days. That's what we are trying to say this here. Uh, we can make these things happen, what we spoke about till now, in a time frame of 90 days. Yeah. And how do we make it happen? I think this one slide summarizes all of them. In the bottom, when you see there, it is about the managed system, what we've been talking about. This is the ERP system. This is the HMS system, which has been there for a very long time. We have an ERP, HRMS, lab interfaces, PACS, or all those systems put together help us manage our business, right? It automates workflows. It helps us manage our businesses. That layer is already there. That's the managed layer. Now, on top, what you see is the grow layer, right? In the growth layer, we are talking about how do we grow physician side? How do we grow on the patient side? How do we grow on the data side? Okay, that is what we have put there. On the physician side, on the clinical side, we are saying systems like, or the smaller AI systems like the Cura.ai can improve efficiencies for doctor. In a similar way, we talked about consultation being in conversation. We can use ambient AI for documentations. The conversation can be easily converted into clinical notes. Okay. Of course, we also talked about AI assisted clinical workflows or decision support systems. I think those are the new systems which we can build on top of the manage, which helps you to grow. On the customer side, we spoke about Care Loop. It's an engagement platform. It helps better outcomes for the patient. It improves trust for the patient on the doctor and the hospital. It increases engagement. Of course, it also prevents certain revenue losses. Okay. Further, there are extensions on telehealth. There are extensions on patient mobile app and all that, which helps patient to engage with the hospital better. I think those are the areas we talked about. Of course, the self-service model is one more thing what we spoke about. And then on the data side, once we have all this data, how this kind of a new age intelligence and analytics can help you move from reactive care to proactive care and and engage your patients even more better. I think that is how we are saying that okay, these things can be made happen in a time frame of 90 days. I think you're on mute, Matthew.
Sorry.
So
Thank
I
you,
will hand
Naren.
over to Matthew now, okay, so that he can take us through the remaining.
Thank you. That's been a quite comprehensive walkthrough. We've a few more minutes left before we have to close up. So, Sai, if you want to take us through any more questions that you may have collected.
Yeah. Yes, Matthew. So we do have actually a few questions. The first one is actually addressing to Naren. So we heard a lot about AI in healthcare, but most hospital leaders feel they aren't ready. So where should a hospital actually start?
Yeah, that's a very good question. I think today we hear AI more than anything else, but I think the right place to start is data. Okay, look at how is your data. Okay, today most of the data are fragmented across departments. Uh, get that sorted, get that in one platform before any AI can work on it. Okay, I think unifying those data records in one place, getting your data to flow, I think that is the step one. Okay, and then we can build all these AI layers on top of them, which can bring in very different value propositions. I think that's where we should start. AI is not necessarily a very costly affair. Okay, AI today has become really democratized. We can use a lot of we can make AI work in a very short span of time with very less investments. That is how AI is kind of moving towards.
Okay. Also adding to the above question, Naren. So for a hospital with a significant AR outstanding, where is the single biggest revenue recovery opportunity right now?
That's a very important question to answer because all of us are worried about our AR. Okay, I think denial management, okay, in some ways is very important. Okay, most of the hospitals today don't have very clear visibilities into claims. Okay, and which claims are being denied and what is the reason why it is being denied, and also their ability to accumulate data and submit their claims quickly is very limited. Okay, and that is when a lot of claim rejections happen. Okay, but with systems today, we can build this better. We can bring in predictions on certain claim rejections and build that faster. We have worked with a lot of hospitals, okay, whereby we have improved their whole claim process, thereby bringing down their claim rejections to bare minimum. And that is an ongoing thing. Claim rejections can be always improved. But I think we have done this work, and that is one way to go about solving the AR problem.
Thank you so much, Naren. Matthew, this question is for you. Hospitals in our region are worried about compliance, particularly with Sibahi and JCI tightening requirements. So, how does Medina's help with that?
Good. I think that's definitely a big concern as many hospitals prepare to take those kind of certifications. Uh, the possible direct answer I can give you is that in our list of customers that we've been dealing with, we've dealt with hospitals that have gone through that process, and through that process, Medinaus has been able to build in a lot of these standardized reports that are available out of the box, audit trails or role-based access logs, post-discharge follow-up records or interoperability, compliance, etc. It's all there and available. So hospitals that run Medinaus don't need to actually scramble just before the auditors come to set the whole thing up. It's already there. And we've seen this across hospitals that we've supported in GCC as well as in Africa. and we know exactly what those standards require, and we've already built that into the platform. So they have a head start in that respect.
Yeah, thank you so much, Matthew. Back at you, Naren. So, how long does it actually take to implement Medina's and see the results?
I think we are serious about the 90-day framework. I think 90-day today, what you're saying is based on real implementation experience. Okay. I will split it into three phases. Okay. I think day 1 to 30 is about stabilization. Okay. Getting the data flowing and the visibility in place. I think it's about building the right systems in place. I think that's what is 30 days, first 30 days. By the end of first 30 days, ideally, you should have operational data very clearly visible to all of us. And then from the next 30 days is about optimizing revenue, right? They are in the forms of submitting your claims on time, reducing claim denials, improving your or reducing your AR. That is the next 30 days. And the last 30 days, for example, is about governance, right? It is all about meeting compliance. It's all about being audit ready, improving your discharge protocols. Okay, that's how it is. I think split into three phases. The platform goes live in phases, so you are seeing result before the full implementation is complete, followed by continuous optimization. I think that's how we split this into three phases. And the 90-day framework is for real, and we have been consistently making this happen.
Yeah. So the last one is for you, Matthew, and for the day. So, what's the first step for a hospital that wants to explore working with Medina's?
Good question. Basically, ask a very important, how do I get started? Well, the answer is very simple. It's a basic conversation. That's how we start. We do an operational assessment first. We look at your current state, where the data is, how fragmented the data is, where's the revenue leaking, what are the compliance gaps that you have, and then with that assessment, we build a 90-day roadmap that Naren spoke about. It's very specific to your hospital, your modules, your problems, your market, your regulatory requirements and environment. And it's as simple as that. And for those who are really keen and interested, you can go into our website and ask for an assessment there. And we'll have a team of our people engage with you to take you to the further steps.
Yeah, I think we are done with the Q&A session. So thank you so much, Matthew, and thank you, Naren. And thank you to everyone who stayed with us from across the Middle East, Africa, and the Caribbean. I know your time is very valuable, and I hope this felt worth it. What struck me about today's conversation was that we weren't really talking about healthcare in the abstract. We were talking about the specific decisions that all hospital leaders face on a day-to-day basis and a very specific sequenced way to address them. So, if any part of today's conversation resonated with you, if you found yourself thinking about your hospital's operations or your revenue cycle or your compliance readiness, I'd encourage you to not sit on it. So, you can book your assessment at medinas.com, request a demo, and we will be back with you to support you. So, on behalf of Matthew, Naren, and the Medinas team, thank you. We hope to be speaking with many of you individually very soon. Good day.
Thank you so much.
Thank you.